I want to welcome everybody to the seminar today. And you're in for a real treat to be able to hear from Betsy Nightingale. And as you can see by her title of her presentation, this is super relevant to our Wayne State University CLEAR Center. And our program coordinator for CLEAR, Lara, will go ahead and host this session.
Okay, thanks. We're going to have a presentation for, I think, probably at least 45 minutes, but save some time at the end for questions. And so we're really glad to have Betsy Nightingale here with us with our Superfund Research Program. She's one of our external advisory board members. And as we said before, that she's the on-scene coordinator for the US EPA for emergency response under the Superfund program. She's local here to Michigan usually, but she's been spending some time lately in East Palestine, Ohio, working on the cleanup of the trail derailment problem there. So I know she's been super busy, and we're just really, really thankful that she was able to spend the time today to come and speak with us about her work on disaster response and vapor intrusion and Superfund sites. So with that, take it away, Betsy. Thanks.
Okay, you can hear me okay and see my screen okay?
Yep.
Okay, thank you. Well, thank you for having me today. And I am actually currently still at the East Palestine response, so I apologize. I tried to find a quiet corner to come into, but if anyone happens, there may be traffic through the trailer and things like that, so I apologize about that. But I was going to talk with you a little bit about the vapor intrusion work that we do in US EPA Region 5 within the Superfund Emergency Response Program. So the things I was going to cover were, just sort of a high-level overview of our work, how we tend to do vapor intrusion investigations, some of our quality assurance and quality control measures, some of the ways in which we try to engage with communities and evaluate results and communicate those to communities. And then when necessary, often we install some pretty common types of mitigation to address vapor intrusion issues, and then how we follow up to make sure that mitigation is effectively working, and then just share a few resources. And as I said, yeah, we'll focus specifically on Region 5's emergency response program work. As you all know, EPA is a very large agency, and we have so many experts within the agency who do work on vapor intrusion issues at the regional level and our national levels. And so there's so many other people who could also come and present various aspects of EPA's work on vapor intrusion. And I'm happy to provide some other names too, if that would ever be helpful. But so just to, again, review the definition of vapor intrusion and as we typically consider it. So, there's often some kind of spill or release that gets onto the ground and contaminates the nearby soil and can then eventually migrate down to groundwater and then flow in groundwater plumes and can sometimes flow through soil and soil gas plumes, and eventually impact buildings that may be sitting above, a soil gas plume or a groundwater plume, or even sitting close to the source area and sitting in contaminated soil itself, or sitting along conduits, because the contamination can be intercepted by various piping and other infrastructure that may be subsurface. So those are all things that we think about, in assessing vapor intrusion, within the US EPA. And my program specifically, and I think we'll talk about this a little bit more later. So we are most focused on exposures within buildings. We tend to focus a little bit less on longer term cleanups once we have ensured that the indoor air is safe, within buildings that are above plumes for people to be able to continue to occupy them. There are other programs we pass sites to generally for long-term cleanups of contamination in the ground once we've kind of stabilized the situation as the emergency response program. So some of the typical vapor intrusion chemicals of concern that we address within the program, most of my work in particular has been with volatile organic compounds and primarily with PCE and TCE, so tetrachloroethylene and trichloroethylene. And also mercury. I mean, you could say mercury is sometimes a vapor intrusion sort of hazard as well. Although a lot of times when we respond to mercury, there's actual mercury sitting within the home or near the home that's actually releasing vapors right there inside and not necessarily migrating up from the ground. And a lot of these other chemicals are things that I think we tend to do a little bit less work with on the vapor intrusion front, but there's definitely research and consideration of many of these. And we do often also address methane in vapor intrusion scenarios. And feel free to stop me if anyone has any questions too. So, being a federal government agency, we have to work within the authorities that we're authorized to work under. So for vapor intrusion response, the primary regulation that we work under is called the Comprehensive Environmental Response and CERCLA, basically. That's the most common regulation that my program works under to address vapor intrusion issues. That allows us to address releases of hazardous substances. And so like PCE and TC, for example, are listed hazardous substances under CERCLA. So we have the authority to address releases of them that threaten human health or the environment. We also sometimes can address vapor intrusion related issues under the Clean Water Act and also under RCRA, the Resource Conservation Act, but it's less common. And I can talk more about why, but and to be able to take an action under CERCLA, to address any kind of site, vapor intrusion or otherwise, we have to develop a decision document called an action memo. And in that memo, we have to basically document why we think that action is necessary and how it fits, under the stipulations that CERCLA has for taking that action. And the most important thing is that we're able to document that there's actual or potential exposure, from the chemicals that we're concerned about, through vapor intrusion to human health or to the environment. And so document that in that action memo. It's also very important to us to develop conceptual site models, to the extent that we have time, sometimes in these emergency situations, but to try and understand how to fix the problem, basically, right? You need to have an understanding of how the problem is being created. So understanding, I've had sites where, every scenario across the board. I've had sites where the building is so close to the source that, I believe it's actually vapors coming right off of that contaminated soil and right through basement walls, for example. And I've had sites where, there's a groundwater plume that's in the ground and vapors are coming, the contaminated groundwater is traveling quite a ways from the original source area. And then vapors are eventually coming back up off of that groundwater and impacting buildings further downstream. And I've also, I'm sorry, I'm not very familiar with Zoom. I can minimize these pictures. Okay, now I can see the whole slide a little bit. I've also had sites where there have been conduits. So, as we talked about a little bit earlier, piping that has been placed in the source area where contamination may have been released is intercepting contamination. Either typically in the experiences I've had, it's been soil gas. It's the contamination gets into bedding material or into actual sewers, and then travels through another pathway and impacts buildings. And a lot of times when vapors or contamination gets into sewer bedding or into actual sewers, there's potential for that to flow back into buildings as well. So that's another scenario that I've had on sites that I've worked on. So a lot of different ways that vapor intrusion can impact communities and structures within them. So when we start out a site here at EPA, and I mean, in my position, we're not necessarily experts on any one thing. We're faced with a wide variety of different types of contamination scenarios, not just vapor intrusion, all different kinds of contamination scenarios, and trying to just figure out how to come in and be able to address those and make them better, and minimize exposure of human health and the environment from chemicals. in these emergency situations often. So one of the things that we recommend is just creating a team. And that's why we're so fortunate within EPA to have so many different experts that we can call upon to help us think through, a particular situation that we're addressing and try to come up with the best solution that we can. So we try to engage teams of, technical experts within EPA. We have a number of technical contractors as well that we can bring in. Also work very closely with state agencies, with local agencies, with our attorneys, with our enforcement specialists, with our community involvement coordinators that are kind of experts at communicating with the public. And one of the most important ones, in my opinion, is working with local and state health agencies and EPA toxicologists. Because as I said, we're kind of not experts really in anything in my position, and we're definitely not experts in understanding and potential impacts, of chemical exposures to human health. So trying to have someone to advise us on, say we're seeing X level of PCE in indoor air, is that a level that may impact someone's health, and help us make those decisions. And then help, in some cases, take actions. I've had a number of sites where a building has actually been condemned because the levels of a contaminant are so high. And EPA isn't authorized to condemn buildings. So we usually work, in concert with the health agencies and provide them information about the levels of contamination that we see. And then they help determine what next steps are needed to make sure that human health is protected. So when we're starting out, when our assistance is requested on a contamination situation, we try and gather existing information and just understand what's known about the site, and then basically go from there to figure out if in some cases there may be enough known about the site that a plan of future action is clear, or in some cases you may need to collect more information before you can understand what further action may be needed at a site. We try to collect multiple lines of evidence at the sites that we respond to, and this is a little bit limited sometimes by the amount of time that we have to spend at a site. So some of the most important things that we do when we suspect there may be, kind of an emergency situation that needs to be addressed related to vapor intrusion is collect indoor air samples and collect subslab samples. And, and then hopefully there is some existing information out there about the conditions in groundwater and the conditions in soil. But some of the first work that we do is just, look at what's in that soil gas right below the building and what's in the indoor air. And if you happen to have real high levels in indoor air, but you're not seeing anything in soil gas below the building, that may lead you to think that it's an indoor air source. But if you have really high levels of a chemical, below the building and then also in the indoor air, it's likely a vapor intrusion source. Or, high levels in the indoor air and high levels in the conduits, like sewer lines, coming into the building, that may lead you to think it's associated with a vapor intrusion problem. And the different scenarios and responses can vary depending on the situations that we're trying to address. But like I said, our highest priority is just making sure that vapor intrusion is addressed so that it's safe for people to occupy those buildings. So sometimes groundwater characterization, can be a secondary priority for us, but whenever possible, we try to understand any existing groundwater data from the site, and then if necessary, collect additional groundwater data ourselves to characterize where a plume may be, and the levels of contamination in that plume, and then help us assess what buildings sitting above that groundwater contamination plume may be subject to vapor intrusion. And then we can go out and collect, soil gas samples and subslab samples and indoor air samples to help understand whether those buildings are being impacted by vapor intrusion. And then same thing with soil gas, comprehensive soil gas surveys of a community sometimes aren't the first thing that we do in my program. In some cases, there's a lot of existing information available. Like this image on the left is a site that was referred to us where the state had done a pretty comprehensive study of the soil gas in a neighborhood. And this was the result. This is a PCE plume in soil gas in a neighborhood. And so we were able to take this information and better understand which buildings, may be being impacted by that soil gas contamination plume. And so if we have time, again, depending on the situation, we'll work to collect external soil gas information as well from areas that we suspect, may have contamination problems and help us understand which buildings again maybe impacted by that contaminated soil gas. And then also soil. We've had the opportunity to do, soil cleanups in some sites that we work on in the emergency response program. Sites that are just presenting a tremendous risk to buildings that sit in that contaminated soil essentially, and have been able to use some really neat tools like membrane interface probe analysis to understand how contamination varies across a geographic area and to depth as well, which has been really amazing. And then understand how help you evaluate some techniques that you might be able to use to clean that up. But it is a little more rare that we're able to do those source cleanups in the emergency response program, as I mentioned. This just lays out a few different scenarios and the types of samples that we would take depending on the type of structure that sits above the contamination. So if there's a house with a basement, we typically collect sub-slab samples and then indoor air samples in first floors and in basements as well. If a house is on a slab, we would collect sub-slab samples and then indoor air samples within the indoors. And then if a house has a crawl space, we typically, and it depends if the crawl space is gravel based or soil based, or if it actually has a concrete floor. So if the crawl space has a concrete floor, then we could collect sub-slab samples as well. But if it's a gravel based floor, we would just collect a sample of the air in the crawl space and then the air within the home to try and understand the contamination profile. We work really hard to try and remove household sources of contamination that may contain some of the chemicals that we're actually looking for and maybe in the subsurface contamination plume. So we walk through houses, with real-time air monitoring equipment and look and ask people where do they store chemicals and look at all the chemicals that they have, screen them with our real-time air monitoring equipment. And if we're suspicious at all that they may contain one of the chemicals that we're trying to understand, the pathway for it, we'll remove those chemicals from the building, package them up in plastic totes and place them somewhere else for at least 24 hours before we go in and collect indoor air samples. So remove those chemicals and then go in and collect indoor air samples. And this is just one of the references that we use to help us understand, if we have a particular product and we're not sure if it may or may not contain a chemical of concern for our site, we can refer to this website and it'll help us understand what may be in a particular chemical. Another thing that we found to be really important is completing a building survey when we enter a building, because a lot of times we're going into many buildings and it's easy to forget, what a particular basement may look like as you go from building to building to building. So there are a number of factors that we look at as we enter a building, how many stories it is, what's the layout of the building. And in basements, what is the floor made of? Is there a lot of cracks? Is there a sump pump? Does there appear to be groundwater intrusion coming into the building? Just a series of questions that we go through and try to, collect that documentation so that we have it for future. And once we get sampling results back, we can go back to this documentation and help us understand why we might be seeing results that we're seeing in sampling sample analysis. There's a number of different media that we can use to collect samples, air samples specifically in this case. Typically on sites that I work on, we use evacuated canisters, so SUMA canisters. And for residential scenarios, we typically collect 24-hour indoor air samples in evacuated canisters. Recently, I've also started using passive samplers quite a bit as well. And one thing that I found to be really helpful about passive samplers, there's a particular kind that we're able to deploy for 30-day periods at a time. And I've had some situations recently where I've worked on sites where contamination levels have been shown to be pretty variable in the indoor air. And so I worry that, if I just go in there, a couple times a month or something and collect a 24-hour sample with an evacuated canister, that I might be missing some of this known variable contamination that we're trying to address through a legal process and haven't been able to stop yet. So deploying these passive samplers has given me a lot more confidence, and understanding of levels that folks, may be exposed to. And in my case, I've been able to document that they're not being exposed to high levels, over those periods of time when I'm not on site collecting those evacuated canisters. And we also, periodically have the chance to use some real-time instruments as well. I've personally found that, a lot of the typical photoionization detectors that we have available, in our offices don't see the low levels of chlorinated compounds, because our health action levels are generally very, very low for those compounds. So a lot of times I've found that, my readily accessible real-time tools don't see something, and I compare the results that I saw with the real-time tool to the results that I get back from an analytical lab, and so I don't think that they're reliable for real low levels of contamination, but there are some other tools, and I'll talk about one in a minute, that is a real-time analytical tool that is really reliable. So we just evaluate the particular situation and try to find the best tools to bring to it to help us understand what the problem is, and then how to address it. So a little bit more, these are just a few images of us drilling holes to install sub-slab sampling ports, and then starting to collect those samples. These are a couple different options for sub-slab sampling. A vapor pin is one option. So this is kind of pretty easy to install. It's kind of a one-piece little device here that you just basically drill a hole and install, and then it comes with a cap, and you can cover it and it doesn't look bad. EPA's environmental response team actually recommends this type of sub-slab sampling apparatus. It's put together with swage lock fittings. It goes a little deeper. I think they believe it leaks a little bit less over time. And so this is what they recommend. So I typically follow that recommendation and install these sub-slab sampling ports at my sites. And then, we install the port and then connect a SUMA canister to it, and can collect a sample over 24 hours, or sometimes we collect a grab sample too. But we try to install the sampling port, let it sit for ideally 24 hours, and let conditions stabilize, in the subsurface, and then collect the sample. Indoor air sampling, I kind of talked about this a little bit already, but generally speaking, we use the evacuated canisters in residential settings, collect those samples over a 24-hour period. And I'll talk a little bit more about this on a later slide. Crawl space sampling, we have to be a little bit careful with crawl spaces because they can be confined spaces. So in some cases, we're just basically dropping a sampler in there and then picking it back up if we can't readily access the crawl space. And in other cases, the crawl spaces are more accessible, so able to actually enter them easily and collect a sample. And then preferential pathway, I could probably talk about this for quite a long time, just as a whole separate conversation, but it's I think it is just a very important thing to look at vapor intrusion sites. If you have contamination moving through these preferential pathways, in manners that may be completely different than ways contamination may be moving in a plume. And so what we'll often do is collect samples of air from sewer lines that are near the source area, and try to delineate any contamination that may be flowing through I personally worry about sewer lines more than a lot of other preferential pathways. And so we will collect samples from the sewer lines, see if we can see contamination in sewer lines and in manholes. And if we do, then try to delineate, the length of sewer that seems to be impacted and what properties are connected to that sewer. And then we'll go into the properties. And I usually start by sampling at the sewer cleanout. We'll collect a sample at the sewer cleanout, see if we're seeing contamination in that. And then if so, potentially take some other actions. And I'll come back to this, but the high level overview picture is, one of the first things that we try to do is make sure that things like P traps are maintained with water, so that, and in some cases P traps haven't been installed in buildings, but often they are installed, and a lot of times they're not maintained, in basement floor drains or basement toilets or things like that. So just try to pour water down all the drains, especially in the basement, and that way you're filling those P traps and hopefully blocking the potential for any contamination from soil gas that's made it into sewers to enter a building. Just trying to keep an eye on the time here. So field QA/QC. So when we're doing air sampling, we typically analyze, evacuated canister samples via DOE method 15. That has a 30-day hold time, but we rarely in my program hold samples. We usually send them immediately to a laboratory. We have to verify and that the laboratory's reporting limits can meet the screening levels that we need for a site. As I said, these health action levels are often very low. And so we need to use often trace analyses or SIM analyses to make sure that the analysis can show us whether the contamination is above or below the screening level. Really, really important. We always use individually certified SUMA canisters for indoor air sampling, a canister that's been cleaned and been tested to make sure that it's actually clean, because those canisters are reused across sites. So individually certified canisters. Our emergency response team also has a procedure to ensure that these canisters that have regulators attached to them to collect these 24 hours to ensure that the regulator is functioning properly, so that we don't end up losing our sample, and that because you go out and you work so hard to get access to people's properties, and you deploy all these samplers, and then if you have a situation where, say, a regulator isn't working, and the canister basically empties prematurely before we get back there 23 hours later, wasted everyone's time. You've wasted the homeowner's time and your time trying to do the sampling, and then you have to get more equipment and do more sampling. So we try to check everything that we can to make sure that everything's working as well as can be as we're collecting these samples. Our protocol is collecting 1 duplicate for every 10 samples that we collect, across all media, generally speaking. So collect duplicates, according to that plan. Every time I do vapor intrusion sampling as well, in indoor air or subslab sampling, I collect ambient air samples, because we've also had situations where the actual ambient air outside is contaminated, and that's what's flowing into people's homes. So just trying to, again, understand where the contamination is and then how to address it. Another QA measure that we use is leak testing. So as we install those subslab sampling ports, sometimes, and we seal them up, sometimes they either when you first install them or over time, if you're going back and resampling them periodically, a leak may have formed. And so you may be if you have a leak, you could suck ambient air into your sample, and you wouldn't have a good understanding of the conditions subslab. Right. So it's really important every time we collect a sample, we do leak testing to make sure that we're not contaminating our subslab sample with indoor air. And then I talked about this a little bit, but just making sure that our regulator is flowing correctly before a sample is collected. And then just a few references here, if you'd like more information about our procedures related to that. One tool that we have that is amazing, there are these mobile laboratories. called Taga buses. And so the Taga has a mass spec on it, and you can use it to do real-time air monitoring for many, organic and inorganic compounds. And then it also has a GCMS on it too. But in this context, what I was going to talk about specifically was using that mass spec, and I'll show an example. So this is the inside of the bus, and what you can do is, pull this bus up to somebody's house, attach a long hose to the bus from the equipment in the bus into the person's house, and walk into the house with that tubing and start screening and slowly screen each room. And you can walk up to, say, a crack in a basement floor or something, and assess levels of PCE around that crack. Or maybe there's a hole where a piece of piping comes into a basement, assess levels of contamination. And you can invite the homeowner to come and sit with you on the bus and watch those results real time. And it's just, it's an amazing tool. And these are a couple of pictures of the Taga operators walking through homes, with that hose, and feeding air from that hose back into the Taga, and getting that real-time analysis done, and watching those results come in. And so one of our lead chemists, his name is Dave McCunis, he has these videos that are produced when he does Taga analyses. So it's just going to show you an example of what that looks like. No, oops, I'm sorry. Don't touch it. So it'll take just a minute. So this is a house that they're assessing. They're outside right now. Levels are low in that dark blue. They came into the house, the living room. Levels are a little bit higher. In the bird room, similar levels. The kitchen, similar. The bathroom, similar. A bedroom, similar. Another bathroom, another bedroom, similar. Another bedroom, similar. Now they're in the basement. Computer room is similar to what we saw upstairs. Family room. Another bathroom in the basement is similar. The closet, levels are getting higher of TCE. The game room levels are lower than the ambient. Lower than the closet. The storage room, the laundry room, levels are similar to what we saw upstairs. The garage, levels are same as ambient, very low. And then now they're back in that closet where they saw the highest levels, and look at that. They've identified where that contamination is probably coming into that building. And it's without a tool like that, it can be really hard to know for sure where contamination is coming into a building. And I included a few other animations from various Taga bus investigations that have occurred. I won't play them all here because it takes a little while, but in this particular case, they identified a household chemical to be the source of the contamination that was being observed in a building. It's an amazing tool. Community outreach and communication is something I also work very hard on in our program. So we have some references that we're able to share with communities and with residents to help them understand vapor intrusion and the types of things that we're investigating, the types of communications that they might see from us. We also have, I'm sorry, I'm not going to play that, but you'll have the link to it. But we have some videos that we've created so they can, so if we're asking them to collect subslab samples or indoor air samples, they can watch that video and look at what that process entails and what a subslab sample would look like installed. So it can help them assess whether that's something that they're comfortable with. This is a communication survey that was done that helped characterize people's concerns related to these types of situations where you may have contamination within a community. So it's something that we try to look at and, improve our communication and address their concerns, in our communication. For EPA to collect samples within someone's home, we have to get permission, formal access to collect those samples. And, for homeowner occupied homes, we just seek access from the homeowner. For tenant occupied homes, we seek access not only from the property owner, but also from the tenants as well. And then as we get results, we work with, as I said, health agencies and toxicologists to understand the impact of those results and what next steps need to be taken to address, particular levels that we may be seeing. And we just, try to communicate those results back to the homeowners as quickly as we can, and either address any questions that they have and bring in others to help us address questions if we're not able to address those questions. We have a Region 5 vapor intrusion guidance manual that was published in 2020. So this is a flow chart that helps us evaluate results that we may be getting back. This delineates some emergency types of scenarios. So for example, if you have an indoor air sample or you're walking into an indoor air environment with a handheld meter and your lower explosive limit, so it exceeds 1%, or there's evidence that there may be an explosive atmosphere. I'm sorry if that keeps flashing. That's a very imminent emergency. So that's something that we try to address immediately. And then this has some other scenarios with some recommended next steps. So that's in our 2020 guidance document. We also have a vapor intrusion screening level calculator. I personally don't use this. I request when I'm working on sites that our toxicologists develop these numbers for me. So this is a calculator that helps us develop screening levels that we can compare results to understand the severity of the results that we're looking at. And then once we have those results, we communicate how we got them, and what we found and what we believe they mean, and then what happens next. This is an example of a letter that we would share communicating results back to a homeowner. And then mitigation techniques. So, as I mentioned, we're in the emergency response program. So we often are trying to address emergency sorts of situations related to vapor intrusion. I mentioned here again that we don't have the authority to evacuate buildings, and an EPA should not be doing that, but working in conjunction with local authorities and health authorities if that sort of procedure may be needed. It's in really bad situations, evacuation is something that can be needed if levels are very high within indoor air. Another thing that we do immediately when responding and we believe that there may be high levels of contamination in indoor air within a building is try to increase ventilation. So trying to seek 4 air exchanges per hour if possible, and just getting some fresh air moved through. We've also had a lot of great luck with air purification units that use activated carbon to help filter indoor air within buildings. So we actually keep about 30 of these in a warehouse, and we can bring these out very, very quickly to sites and deploy them and get them up and running, and then go back in and collect samples after they've been running for 24 hours, or after they've been running for a couple days, or even after and we've had really good luck with showing that they're able to be used as a short-term method to help get indoor air conditions improved. Another thing that we do is take a really hard look at basement floors and just go in and seal any cracks, any holes, where conduit piping may be coming through, and there may be gaps that may allow better communication with the soil gas and the air within the basement. So go through and seal holes and cracks and gaps immediately. Also, I've usually, if there is a sump in a basement, I'll seal that as well, because sometimes we've found that vapors are coming either directly through the sump if it's dry, or if there's groundwater in there, there's potential for volatilization off of groundwater. So sealing that off and then getting that addressed. And then, as I talked about a little bit before, maintaining vapor traps. I talked about this already, sealing sumps. And then also being sure to assess whether or not, if you think you have a contaminated groundwater plume, whether or not there may be people drinking that water. So is the community on municipal water, or do some people have wells? And if there are wells, then you need to collect samples of that water to make sure that that water is not contaminated that they're drinking. And then evaluate effectiveness of those immediate actions that you've taken to try and help stabilize the situation. So this just shows an example of one site that I worked on. So we went in, and PCE levels were relatively high across, several floors of the building. We started ventilation and then collected some samples and were able to drop those. And then we got a subslab depressurization system installed and collected more samples, and we're able to drop the levels further, but not quite. It wasn't quite comfortable. We weren't quite well enough below the action levels. So in that particular case, we also needed to install vapor barriers. This was a series of buildings that were very, very close to the source area of contamination, and contamination was coming through the walls of the buildings, the basement walls, in addition to up through the floor. So installed vapor barriers along the walls and the floor to help stop that contamination. Then once we've taken emergency actions to try and stabilize the situation, then we work towards more of a longer term solution. So installing subslab depressurization systems is one thing that we frequently do within our program. So these are radon style mitigation systems that typically can take contamination that's potentially flowing into the house from below the house surface and vent it up and pull it up through a fan, and with piping, discharge it up above the roof line of the structure. And this is some details about how, recommendations for installation. And these are a good application to think of applying these within is in buildings where basements have very good like uniform concrete floors. If you have a lot of cracks and you're not able to seal those, or if you have gravel or dirt floors, you won't be able to intercept that's contaminated subsurface gas and shunt it up above, because it's just free flowing basically into the basement. So, you need a good comprehensive floor to install those systems. This was a funny situation. I went into one basement at one site I was working on. And this site was located pretty far down the groundwater plume, so it wasn't right in a source area. And this is the wall. This is their basement wall. It's made of sand. And I looked at that and I was like, oh my gosh, what are we gonna find? What are we gonna do about this wall? And so we collected subslab samples in this building. We saw contamination in the subslab. We went ahead and installed a subslab depressurization system. So left that wall alone initially, installed that subslab depressurization system. And what we found was we were actually able to intercept the contamination. Most of the contamination that was impacting this building was coming from below the building. It wasn't coming longitudinally towards the building. So that subslab depressurization system stabilized the situation. And we did a year of follow-up monitoring and sampling, and never saw elevated levels again in that indoor air in that basement. There can be a lot of other complicating factors, as I know everyone probably knows, but we just do our best to address those on a case-by-case basis. And then once we've taken those emergency measures, taken some kind of midterm measure like installation of a subslab depressurization system or vapor barriers, or installing a more uniform floor, and then installing mitigation, we work to confirm that that mitigation is effectively protecting the residents from contamination in their indoor air. So we recommend a year in our program of post mitigation testing to make sure that that system remains operational and remains effective at controlling contamination. We also develop operations and maintenance manuals for any mitigation systems that we install, that we give to the homeowners and we give to local agencies in the area, so that, you know, once the emergency response program is gone, they'll have information about the mitigation that was installed. And then, you know, once we've completed that 1 year of verification that mitigation is working, you know, generally speaking, at our sites, there's still contamination in the ground. So there's still a threat that something may change over time, you know, because our program isn't often able to clean up that source area of contamination. So I often refer the site back to the state or local agency, or refer it for listing on the national priorities list, which is the long-term Superfund cleanup program. And I think you said you want to maintain a few minutes for questions, so I can stop there if you want and take any questions. I think that covers most of it.
That's great. Thank you, Betsy. That's so detailed. In fact, one of the main questions we're getting from a lot of people is whether these slides are already posted someplace online, or if we can post them on the CLEAR website. There's so many great diagrams that others would like to use for teaching purposes.
Yeah, I think that'd be fine.
That's wonderful. Thanks so much. So one of the questions I have actually is, you mentioned a lot about the different agencies, but I would imagine some of our, you know, community partners who may know that they have an old dry cleaner down the street from them or whatever, you know, that may not really know if there's been any action on it. You know, can you talk a little bit about the roles of the different agencies with different sites, how attention gets focused on this in the first place, and, you know, before your program maybe, or in, you know, combination with your program?
Yeah, so I think it varies how we end up getting invited to participate in a response, or our assistance is requested. But, you know, so I work a lot in Michigan, and in Michigan, there's that baseline environmental assessment process that is available for people who are interested in purchasing properties. So they'll go in, look at a property that they may be interested in purchasing, and evaluate whether there's any existing contamination present, document that process of evaluation, and submit that to the state. So the state has this database of evaluations of properties that are changing hands, basically. And a lot of times that is the way sites end up getting referred to my program, is the state is, you know, looking at that suite of sites that they're aware of, that there may be contamination, or there might have been some operation that might have caused contamination, and they look at the data that they have, you know, about those areas. And sometimes the state will go in then and start to collect more samples to try and understand, you know, is there what the current situation is basically for a particular property. And so the state will collect more samples, and then they'll see levels of concern in one or more media that they've sampled, and then request our assistance with the site for emergency types of situations. You know, so it can be through property transactions that, you know, even in other states, people are doing phase 1s and phase 2s and trying to understand the property as it's changing hands, and then those will get referred to us. I'm trying to think through different scenarios that I've worked on. You know, so a lot of times I don't know what triggers the initial work, but there's some type of environmental assessment that's been done in an area for one reason or another. And then they come to suspect that there's potential for a vapor intrusion problem. And then they'll request our assistance with evaluating that in some cases. I hope that helps.
How
answer.
available are these passive samplers that you mentioned? I know we had a question about, you know, like, how do you, if all you have access to is a passive sampler, like, how do you decide where to put them? How do you interpret the results? How many do you put in a house to figure out if you have a problem?
Yeah, so they're actually pretty available. There's one of, I mentioned EPA does a lot of different work on vapor intrusion. We have an Office of Research and Development. It's called ORD, and they're actually working on this research project. It's called Soil Safe Communities. And, part of what they're proposing, I think they're sort of in the beginning phase of it right now, but they're working with a community that they're in the process of selecting, I think, and they're planning to evaluate a number of different environmental factors, so changes in barometric pressure. They're going to supply people with radon meters that they can place in their house, because radon can be an indicator, of vapor intrusion, because radon can intrude, like chlorinated chemicals could intrude into a house. So they'll place radon meters in all these people's houses, and they'll have the homeowner monitor the amount of radon in the house. And if the radon exceeds a certain level, they'll ask the homeowners to deploy these passive samplers, and then mail them into the lab themselves. So they're pretty easy to use, and they're pretty readily available. For me, and it's funny, Wisconsin, sometimes it can be hard to get evacuated canisters. If you have a very large site, and it's an emergency, and you're drawing, so you can end up in situations where you're drawing basically like the nation's supply of SUMA canisters to one situation. So that can leave a limited supply of SUMA canisters in some cases for others who are trying to get them. There was a situation in Wisconsin where they were concerned. They were concerned about they may be having an emergency situation, and they weren't able to access access evacuated canisters immediately. So they actually deployed passive samplers for 24-hour periods, just as another way to collect samples of air for analysis while they couldn't get those evacuated canisters or SUMAs. So for me, I deploy those in the same places that I would deploy a SUMA. So in the basements, if you have concerns, if you aren't able to bring out a resource like the TAGA and understand where contamination might be flowing into a building, through any particular conduit, I'd place a couple in the basement, a couple on the first floor, even a couple on the second floor. They're really easy to use, and they're pretty inexpensive to have analyzed too.
That's great. That's good to know. How far are you finding that some of this soil gas can travel from its origin to its point of exposure where it puts people at risk?
So, I think it depends, and I am not a geologist, but I think it depends a lot on the local geology in the area. In the sites that I've worked on, soil gas plumes themselves haven't traveled too far from source areas, a little ways, but not too far. But the ground, once the contamination gets into the groundwater, contaminated groundwater can travel relatively far sometimes, and maintain, a level of concern of contamination relatively far from the source area.
Betsy, if I could just follow up on that for one moment, because my question was, rather than looking at transport in the soil of the gas component, my question was more, what is the farthest that you have seen transport of the VOCs in the gas phase that are actually going along these preferential pathways, perhaps within a sewer pipe? So sewer gas transport.
So I've been fortunate at a lot of sites that I've worked on that we have not demonstrated movement in sewers, but I have one site I work on right now where, I don't know in feet, but it's been documented to travel several city blocks
Okay.
in sewer lines.
Yeah, I think we have a site where we think it's moving about a block or two through sewer.
Right. Yeah, that was going to be my question too, because in Michigan, groundwater is not considered to be an exposure pathway in cities. And so groundwater releases aren't as strongly regarded as a risk in places like Detroit. But the question of how those sewer, and not only the sewer pipes, but the stormwater pipes, because so many basements are connected to stormwater pipes, how those things are interacting with some of this legacy contamination from gas stations and dry cleaners.
Mhm.
I have another question to follow up on. I thought your examples, Betsy, you had here were very interesting. I'm kind of curious to know about the scale in which you normally are working at. The examples here seem to be more individual properties, and when I think of Superfund sites, I think of very large industrial facilities. I mean, I'm sure it varies quite a bit. But were these, I don't know if you can say, were these examples Superfund sites, and are you normally working on individual property basis or more of a neighborhood scale
Yeah,
kind of
so
investigation basis?
I think a few different things to address with that question. So, so this is, we're still part of Superfund, our emergency response program, but we don't very often work on Superfund sites that are listed on the national priorities list. We sometimes will. Our national priorities list management counterparts will request, the assistance of the emergency response program if they believe there might be an emergency, because we are able to work more quickly to get emergency types of scenarios addressed, and then the site sort of continues to be handled by the longer term cleanup program. So so a lot of times the vapor intrusion types of work that we get involved with is, there's some kind of business that operated a long time ago. And a lot of times for these sites, it's small businesses, it's dry cleaners or, larger dry cleaners, laundries, types of things like that. Auto repair shops, that just somehow had some kind of release that got into the ground. And so what we spend a lot of time doing is trying to understand which properties might be being impacted by that contamination. So yeah, every site that I've worked on has involved a neighborhood assessment. And I try to, do enough sampling of all the different media so that I can delineate a clean boundary. Basically, at the time that we're out there, try to understand the boundaries of those plumes and try to evaluate every building that sits above them. Our program, we have, somewhat limited resources. So our highest priority is working with sensitive populations such as homeowners, residences, schools, daycares, nursing homes, things like that. And we put a little bit more burden on business owners to be able to, hopefully do their own cleanups if they're needed. If mitigation is needed in businesses, we'll go in and we'll help them. We'll help them understand if their building is being impacted by contamination, but I think they're viewed as having a few more resources oftentimes. So our first priority is those sensitive populations that I talked about when we're evaluating, how to address a contamination situation in a neighborhood.
Thanks.
Yeah.
Any other questions? We're nearly at our time, but opening it
I'm
up.
curious, you mentioned, Betsy, unless anybody else says anything else, differences between real-time measurements and taking samples and sending them back to the lab. You mentioned there tends to be a bit of variability there, and you tend to put more or have more confidence in the lab samples than the real-time tools that you would take into the field.
Mm-hmm.
Okay, interesting.
Yeah, and
We did
it varies by tool though. I mean, so something like the Taga bus, we have a lot of confidence in the results, but even that, our chemist using the mass spec side of that bus, which is the one that we can hook the hose up to, he recommends that we follow up, on any results of concern, any results that we have that we collect with that bus with samples that are submitted to a lab just to verify.
So Betsy,
I was just going to say, EPA has this policy of considering monitoring data, such as that type of data, or such as real-time data, as screening data. And so we're not supposed to make decisions like, sort of very important decisions with that data. And we need to collect what we call definitive data, which is laboratory data for those final decision points at sites.
I just wanted to mention that there was a question that came into the chat, and we'll make this the last wrap-up question. And it's asking about those TAGA trucks or buses. And this person was asking if they're available for non-emergency situations. In particular, this person lives downriver with industrial drains, landfills, and a Superfund site.
So I think to be able to use that, it's an EPA resource. We would need to have some kind of EPA action going, and it would need to go through a significant approval process. The thing, it is really helpful for, sort of those types of situations that I talked about in the examples. There are also other ways to do assessments, though, even if you aren't able to access a resource like the TAGA, just by collecting suites of samples across different media. So there's, all hope isn't lost if you aren't able to bring something like that to a site.
Well, we thank you so much for all your time today. And we're going to keep you aware of our upcoming seminars. We have a symposium actually coming up on April 4th. We'd like you to be aware of that and maybe pass it along to other people you think might be interested in it. And Lara or Brendan, I'm going to let you close out